Many Ugandan businesses are heavily investing in hospitals and health service points generally, and many, however, often waste too much time, money and resources on ensuring efficiency in service delivery. But with changing times, technological innovations are offering smart options, for instance, a hospital management and billing system.
ClinicMaster software is a hospital information management and medical billing system. Or it automates patient's transaction in the hospital as the patient transacts on a visit basis and daily procedures. That means whatever the patient touches in the hospital is put together as an electronic record of that patient by ClinicMaster.
Profiting from such a venture requires sufficient knowledge of how the medical industry works.
Understand what someone at reception does, understand what the doctor does, understand what people in the lab do, what someone in pharmacy does. Now, once you've got that knowledge in detail with you, you may not need to be an expert in it, but at least work with somebody who has the understanding of these different services on the project. Then after that, try to also think through these processes, figure out how best can I have a system probably to even add value.
In fact, one can save more by putting together a comprehensive system that is able to manage various service points.
We thought of actually coming up with an appointment system to be able to remind us of missed appointments by some of the patients. Now, on starting to work on the appointment system, later on we actually realized the entire hospital had a few gaps here and there, starting from reception, going to the doctor, going to the lab, also pharmacy in terms of record.
It's also key to note that for innovations to work, patience is key.
It really takes time, the system to mature itself, and also you need to get the requirements right, otherwise the system may not be used. So sometimes you'll come up with a process flow, work it out, test it, but on ground results actually dictate otherwise.
But how does such a system make money, and the key virtues one needs to uphold to stay afloat?
We are paid in terms of support. When we deploy the system, probably we charge installation fees. After charging installation fees and training, set up the system, then we go on what we call a maintenance or support fees, which is probably paid every year. We are focused on ClinicMaster, apart from maybe adding value around it. Like, for example, if someone doesn't have a network, a good network, and we have the knowledge and insist that we should also help in the network, we might do, but we don't take any other job.